Hi guys, welcome back to our YouTube channel. So in this video, we'll be looking at gastroesophageal reflux disease or GERD. Gastro means stomach, esophageal means esophagus, and reflux means to flow backwards. So gastroesophageal reflux disease is when gastric contents including acid flows back into the esophagus and irritates the esophageal lining. So the parietal cells of the stomach secrete hydrochloric acid, which helps in digestion but can also be aggressive for the gastric mucosa. But the stomach also has foveolar cells which secrete alkaline mucus to protect the mucous membrane of the stomach from acid. When food enters the mouth, the teeth breaks it down into smaller particles and it's moistened by saliva to make it easy to swallow. When it's swallowed, it enters the esophagus, which carries the food from the mouth to the stomach for further digestion. At the bottom part of the esophagus, there is a lower esophageal sphincter, which is a circular band of muscle that relaxes to allow food and liquid to flow down into the stomach, and then it closes again to prevent stomach acid from moving back into the esophagus, else it can irritate the esophageal lining. So the problem in gastroesophageal reflux disease is that the lower esophageal sphincter relaxes abnormally and weakens, and this allows stomach acid to flow back up into the esophagus, causing frequent heartburn. Smoking, pregnancy, obesity, and hiatal hernia, which is an abnormal bulging of the stomach through the diaphragm, are all risk factors for the development of GERD. A common sign of GERD is pyrosis, or what we know as heartburn, which is a burning chest pain that is retrosternal. So retro means behind and sternal refers to the sternum. So your cares at the center of the chest, right behind the sternum. Another common sign is regurgitation, which is when undigested food together with gastric acid flow back up into the esophagus and causes a sour taste in the mouth. It can also lead to dysphagia, which is difficulty in swallowing, and odynophagia, which is when swallowing becomes painful. Heartburn and regurgitation worsen when lying down flat, because when you lie down flat and the lower esophageal sphincter is over-relaxed or opened, the acidic gastric content can pull back into the esophagus and irritates the esophageal lining. Some extraesophageal signs include chronic cough, which happens because acid reflux irritates the airways, hoarseness, which also happens because acid reflux irritates the vocal cords, epigastric pain, which is pain felt in the middle of the upper abdomen, and bloating. The constant backflow of acid can irritate the lining of the esophagus, causing it to become inflamed. Over time, the inflammation can wear away the esophageal lining, causing complications such as esophageal ulcer. The ulcer may bleed, causing pain and making it difficult to swallow. Also, when the cells in the lower esophagus become damaged because of acid exposure, it leads to the formation of a scar tissue. This scar tissue can cause an esophageal stricture, which is a narrowing of the esophagus, making it difficult to swallow. It can also lead to Barrett esophagus, which is when the tissue lining the lower esophagus changes, and these changes are associated with an increased risk of esophageal cancer. Some factors that can worsen the signs and symptoms of GERD include eating late at night, eating too quickly, lying down flat, eating spicy foods, chocolates, and caffeine, and also wearing tight clothes. And so avoiding late night meals, certain dietary choices, sitting upright, and eating more slowly can improve the signs and symptoms. Diagnosis is based on the symptoms, so a test to monitor the amount of acid in the esophagus can be done. So in this test, a device is used to measure the amount of acid in the esophagus for 24 hours and to identify when and for how long acid regurgitates into the esophagus. Also, endoscopy can be done to examine the inside of the esophagus and stomach, and it's useful in looking for complications such as Barrett esophagus. An X-ray with barium contrast of the upper digestive system can also be taken. Medications for treating GERD include antacids, which neutralize stomach acid, histamine H2 receptor blockers, which act by reducing acid production, and proton pump inhibitors, which block acid production and allow time for the damaged esophageal tissue to heal. Also, certain lifestyle modifications can help improve the signs. So maintaining a healthy weight can help because excess weight puts pressure on the abdomen, pushing the stomach up and causing acid to back up into the esophagus. Avoiding tight-fitting clothing, eating smaller meals and not lying down immediately after eating, and avoiding certain foods and drinks that trigger heartburn like fatty or fried foods, alcohol, and chocolates can help. And in situations where medications are not helpful, surgical procedures can be done. So surgery to tighten the lower esophageal sphincter can be done to prevent stomach acid from moving back into the esophagus. So that's all for today's video, but let's test our knowledge on what we've learned so far. So here is a question. A 60-year-old male comes to the clinic because he has been having intermittent episodes of chest pain. In the past 4 months, he explains that he has about 3 episodes weekly where he develops a burning pain in the chest and abdomen. This occurs when he lies down to watch TV after lunch and dinner. He has noticed a bitter taste also seems to accompany the pain. He drinks about 4 alcoholic drinks daily and does not use tobacco products. His vitals are within normal limits and his BMI is 34 kg per meter squared. A physical examination is unremarkable. What is the likely diagnosis in this patient? A. Pneumothorax. B. Pulmonary infarction. C. Gastroesophageal reflux disease, and D. Da Costa syndrome. So you can leave your answer in the comment section and we'll discuss it in our next video. Finally, let's discuss the question from our previous video. In the last video, we spoke about acromegaly and there was a question at the end of the video. So here is it. What is the most common cause for the overproduction of growth hormone in acromegaly? A. Lung cancer. B. Hypothalamic lesion. C. Pancreatic cancer, and D. Pituitary adenoma. So the correct answer is D. Pituitary adenoma. So in the last video, we learned that a pituitary adenoma is what commonly causes the excess production of growth hormone in acromegaly. You can watch the video on acromegaly to know more about it. Thank you so much for staying till the end, and if this video was helpful, kindly give it a thumbs up, share with your friends, subscribe, and also turn on your post notification bell to be notified anytime we upload a video. And I'll see you in the next one.